Hi, my name is Amanda Pullman. It is 4/3/22 at 9 o'clock at night, and I am going to do my head to toe assessment. I will scan my room. Okay. Okay. And I'm going to begin my assessment with the skin. I will assess the head, the neck, the face, arms, legs, hands, feet, and the trunk of her body anteriorly and posteriorly. I will assess for color, temperature, texture, turgor, edema, bruising, scars, lesions, nevi, or any other types of deformities of the skin. Her skin feels soft. It is dry. She is, her color is congruent with her ethnicity. It is elastic, and I do not see any nevi, lesions, bruises, masses, or any other type of skin abnormalities. I'll go ahead and continue with the head and the face. I'm going to, sorry about stepping on your foot. I will assess the head. I'll palpate. The hair is fine. It is brown. It is evenly dispersed through the crown. It is, looks good. It is dispersed throughout the entirety of the head. The head is normal cephalic and midline to the shoulders. It is perfect size for her. I'm going to palpate, the temporal arteries. Do you have any pain or tenderness?
No.
Okay, I'm going to palpate the lymph nodes. You've got preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I will also assess for TMJ. Okay, can you open and close your jaw? Do you have any pain or tenderness with that?
No.
No pain, no tenderness, subluxation, or crepitus felt. I will assess for cranial nerves 5, trigeminal, and 7 facial. I'm going to have you clench your jaw. Okay, all right, can you smile? Frown, puff your cheeks, raise your eyebrows, poke your lips. Okay. Cranial 5 and 7 are intact. Okay, I'm going to start with the ears on her face and her head. Ears are bilaterally symmetric. I'm going to feel the pinna, the tragus. No masses or lesions felt. I'm going to look into the ear with my otoscope, pulling the eardrum, or the ear, up and back. All right, and this side. Okay, I have visualized, you can't hardly see me. I have visualized the auditory canal. It is clear, it is pink, there's no cerumen. Temporal membrane is pearly gray in color. It is intact, no perforations. I will assess for cranial nerve 8 now. I'm going to have you plug your ear. I may have to adjust this a little bit. I'm going to have you plug this ear for me. I'm going to do the whisper test. Repeat what I say.
Dog, cat, bird.
Okay, other side for me.
Dog, cat, bird.
Okay, excellent. I'm going to do the Weber test. You should be able to hear this bilaterally. If you can, please say yes.
Yes.
Okay, I'm going to do the Rhine test. I'm going to hold this over your mastoid bone here and then in front of your ear. You should hear it in front of your ear longer than you should over your mastoid bone bilaterally.
Yes. Yes.
Okay.
Yes. Yes.
Okay, air conduction is greater than bone conduction. Bilaterally, everything appears to be within normal limits. I'm now going to look at her eyes, eyelashes, and eyebrows. They seem symmetric. Everything seems to be where it's supposed to be. Eyelashes are evenly dispersed. Eyebrows are evenly dispersed. We're not missing hairs, or it doesn't look like she's been plucking from nervousness. I'm going to look at her sclera and her conjunctiva. Okay. All right, sclera is white, conjunctiva is pink, and there is no infection or leakage or anything like that in the sclera or the conjunctiva. I'm going to do a few vision tests on her. I'm going to assess to the optic nerve. I'm going to have her look at my Snellen chart here. Usually you do this at about 20 feet, but we don't have that much space here. So I'm going to have her look and read the lowest line she can while covering one eye.
LTFPH.
Okay, and do the other, please.
LTFPH.
Okay, and her vision is 20/20 bilaterally. Optic nerve 2 is intact. Okay, I want you to also tell me when you can see my fingers wiggling in your peripheral vision.
Okay, I can see it. I can see it.
Okay, all right. I'm going to look in your eye. I have a few more eye tests to do too, but I want to look while I'm thinking about it before I forget. Okay. Red reflex is visible and optic nerve is, or optic disc is visible, excuse me. Okay, I'm going to test for cranial nerves 3, oculomotor, 4, trochlear, and 6 abducens. I'm going to have you look at my finger, look behind me, and back at my finger again. All right, I'm going to go to your nose. Far left and far right. I'm going to do the 6 cardinal gaze. Try not to go up too high to make you cross your eyes. Okay, everything is smooth, no strabismus noted. Cranial nerves 3, 4, and 6 are intact. I am going to look at her accommodation to light. Okay, hold on. Okay. All right, bilateral constriction. Okay, pupils are equal. They react in accommodation to light. All right, I'm going to look at her nose. Her nose is midline to the head. It is straight. I do not feel any lesions, indentations, or anything with that. I also forgot to say that I was going to assess for the palpable fissures in her face. Those are fine. Within her nose, I'm going to assess cranial nerve 1. That's olfactory. I'm going to have her close her eyes. She's going to hold one side of her nose and smell, please. What do you smell?
Lemon.
Okay, do the other side for me. And what do you smell?
Lemon.
Okay. Nose is patent. Cranial nerve 1 is intact. I'm going to now assess the lips. Lips are pink, symmetric, and open your mouth for me. Here, let me look here. Open your mouth for me. Okay. Okay. Lips are pink. Gums are intact. All the teeth appear to be there, including wisdom teeth. The color inside of her mouth is congruent with her ethnicity. Go ahead and open that one more time. Stick your tongue out. Go side to side for me. Okay, and say ah.
Ah.
Okay, all right. So that will assess for cranial nerves 9, 10, and 12. 9 is glossopharyngeal, 10 is vagus, and 12 is hypoglossal. Her uvula rises and falls with pronation, and her tongue is midline and straight. I am now going to assess her trachea as well as her thyroid. I'm going to go behind you. Okay, I will palpate. Trachea is midline. I do not feel any goiters. Can you turn your head to this side for me? Okay, and the other, please. All right, and back forward and swallow. Okay, I do not feel any goiters. And again, that trachea is midline. There are 0 deviations. Okay. I am going to assess her chest now. If you will, go ahead and turn the other direction. That's just for my camera view. I'm sorry to keep you moving. Okay. All right. So here with the chest, I will, let me assess this. Okay. With the chest, I'm going to assess for any signs and symptoms of respiratory distress, such as accessory muscle use, cyanosis, nasal flaring, tripod positioning, anything like that. I do not see any tripod positioning, no retractions, anything like that. So we are in the clear there. I'm going to palpate for chest wall symmetry. If you will, take a deep breath. Okay, excellent. The chest wall and breasts rise and fall and are symmetric. I'm going to assess for tactile firmitus. So when you feel my hands touch you, can you say 99, please?
99, 99, 99, 99.
Okay, vibrations are heard throughout. I'm going to percuss. Resonance is heard throughout. I will listen. Couldn't find my stethoscope. I'm going to auscultate the lung fields posteriorly. Okay, lung sounds are clear. There are no vesicular sounds heard. I'm going to do a few other little tests here. First is ergophony. I'm going to have you say the word E when I touch you and just kind of hold that E out for me.
E,
Okay.
E,
Okay.
E, 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 E.
Okay, excellent. We're going to do, we did ergophony. We're going to do, let's do the one with 99. Okay, I'm going to touch you. You're going to say 99.
99, 99, 99, 99, 99, 99.
Okay, excellent. And this time I'm going to have you whisper 99. This is whisper eloquy. Okay, excellent. Okay, I'm going to have you turn my direction again. Alrighty, thank you so much. Okay, I am going to assess for chest wall expansion. I'm going to feel here, excuse me. Okay, take a breath. Excellent. Okay, chest wall rises and falls. While I'm doing this, I'm also assessing for any signs and symptoms of respiratory distress. There is no nasal flaring, no cyanosis, no retractions, and no other signs and symptoms of respiratory difficulties or distress, no tachypnea. Everything appears completely normal. So I'm going to now assess for tactile firmitus. Say 99, please.
99, 99, 99.
Okay, and I'm going to auscultate these lung fields again. This time just anteriorly. Okay, excellent. Okay, now I'm going to assess the heart. First and foremost, I will find the point of maximum impulse, which is the 5th intercostal space, mid-clavicular on left side. Okay, I'm going to auscultate the apical pulse for 1 minute. Okay, apical pulse is 89, the rhythm is regular. I will now listen to the heart sounds. I will begin with the 5th intercostal space, left side, mid-clavicular line, mitral. Go to the 4th, left 4th intercostal space, left sternal borders, tricuspid. Erb's point is 3rd, left side, left sternal border. 2nd intercostal space, left sternal border is pulmonic. And the right intercostal space, right sternal border is the aortic. Now I'm going to flip this and do my bell as well. Same thing, mitral, tricuspid, herbs, pulmonic, aortic. Okay. If you will, I'm going to move all of our junk here and have you lean back. Okay. Thank you. I'll have her go at a, ooh, let's readjust that. There we go. I will have her lay at a 30 to 45 degree angle. I will assess for jugular vein distension. If you will turn your head over to the right. I see no pulsations, no JVD. There are no thrills or heaves. I am going to palpate those same areas of the heart that we've been listening to. I see mitral, tricuspid, herbs point, pulmonic, aortic. Okay, I'm now going to listen since we've changed positions. Fifth intercostal space, midclavicular, left side, mitral. Fourth intercostal space, left-sided, left sternal border, tricuspid. Herbs point is third intercostal space, left sternal border. Second intercostal space, left sternal border is pulmonic. Second intercostal space, right sternal border is aortic. Okay, oh, hang on. I didn't do the bell. Okay, mitral, tricuspid, herbs, pulmonic, and aortic. Okay. Okay, now that we are still already laying down, we're going to go ahead and assess the abdomen. The abdomen appears flat. It is symmetric. There are no indentations or deviations that I can visually inspect. I'm going to listen to her abdominal arteries, beginning with the aortic, the renal, the iliac, and the femoral. Now naturally, if I was to listen to these, I would do it skin to skin. However, for modesty, we're gonna do this for patient privacy. I'm gonna listen to her abdominal sounds, beginning with the right lower quadrant, right upper, left lower. I'm going to percuss in the 13 spots here. Okay, resonance is heard. Bowel sounds were normal active. No dullness heard, but if there was dullness, it would be over the specific organs such as the liver. I'm going to lightly palpate for masses. I don't feel any masses. Palpate for the liver here. And the spleen. Liver and spleen are not palpable. Did you have any pain or tenderness there?
No.
Okay. All right. I'm going to have you sit up, if you will, to face that direction again. Okay, and lean forwards for me. Okay, I'm going to go to the 12th rib here, and we're going to assess for costovertebral tenderness. Did you have any tenderness there?
No.
Okay, all right. If you will, we are going to do musculoskeletal stuff now. Go ahead and sit on this end here. I think we'll be able to see a little bit better, maybe. Yeah? Closer like that. Okay. Okay, so we're going to assess for the upper extremities. We will be assessing for the joints of the hands, wrists, elbows, and shoulders. I'm going to visually inspect them for redness, deformities, tenderness, or anything, any types of lesions. Do you have any pain or tenderness whenever I touch anything?
No.
Okay, we are going to look at that capillary refill on those fingers. Appears to be less than 3 seconds. I'm going to palpate the radial pulses. They are even and 3+. I'm going to have you do some range of motion exercises. We will do fingers first. We're going to flex extend, hyperextend, abduct, adduct, thumb opposition. Excellent. Wrist. We're going to flex, extend, hyperextend, and we're going to ulnar deviation is out, radial in, and we're going to rotate. Okay, any pain or tenderness with any of that? No. Okay, we're going to do range of motion with the elbows. We're going to flex and extend, hyperextend. Excellent. Shoulders, we're going to flex, extend, hyperextend. Okay, we're going to internally rotate, externally rotate. Okay, and then we're going to circumduct. Okay, abduct and adduct. Okay, so we're going to do some grip tests. Let me see your hands. Okay, those are good and strong. All right, pull up for me. Okay, and down. Excellent. Grip is 5 out of 5 on all of those. We're going to start doing the lower extremities here. Lower extremities we will assess for the toes, the ankles, the knees, the hips. All of those will be, we'll look for the same thing, the redness, deformities, tenderness, swelling, anything like that. Okay, I do not see any redness, tenderness, swelling, any pain or problems whenever I touch.
No.
Okay, we're going to do, I'm going to palpate the pulses of her feet, dorsalis pedis, posterior tibial. Okay, everything appears to be within normal range. I will do some strength tests while I'm already down here. Pull towards the chair for me and push away. Okay, feet push to me and pull away. All right. We're going to do some exercises, or not exercises, range of motion with her toes. We're going to flex, extend, adduct, adduct. Okay, we're going to do some exercises with your ankle. We're going to plantar flex, dorsiflex. We're going to rotate. All right, eversion, eversion out. All right, with the knees, if you'll stand for me. Okay, we're going to do this where we're going to flex, okay, extend, and then hyperextend out. Other side, bilateral, flex, extend, hyperextend. Excellent. We're going to do the hips. We're going to flex, extend, hyperextend it back. Very good. Other one, flex, extend, hyperextend. Okay, now these are a little bit more difficult to try to stand there and do, but abduct, and then adduct, other side. Abduct and adduct. Excellent. And then the rotate or circumduct. Good. Circumduct. Inversion or internal rotate, external rotate, internal rotate, external rotate. Excellent. Okay, we'll turn. I'm going to have you lean over for me. I'm going to check the hips are aligned. The curvature appears normal. There is no scoliosis. Okay, go ahead and turn back my direction for me. If you will, we're going to lean forward, flex, extend, hyperextend, lateral for both sides. We're going to rotate around. All right, we're going to do our cervical as well. Flex, extend, hyperextend, lateral, and then rotate all the way around. Okay, I'm going to have you hop on one foot, hop, hop on the other foot. Okay, and then I'm going to have you walk 3 paces that direction. All right, and then turn this way. Walk 3 paces heel to toe. Good. Okay, and sit again. We're going to do stereogenesis and graphesthesia. Stereogenesis, I want you to close your eyes. I'm going to place an object. Open your hand. Tell me what that is.
Coin.
Okay. Other hand, please. Tell me what that is.
Paperclip.
Excellent. Okay. Hold your hand open. I'm going to draw a letter.
A.
Okay. Other hand, a number.
Oh, dang. 8.
Yes, very good. Okay. I'm going to assess the vibrations in the medial malleus bilaterally and the proximal ulnar prominence. Okay, you feel?
Yes.
Feel?
Yes.
Okay.
Yes.
Okay.
Yes.
Excellent. Okay, we're gonna do some deep DTRs. Okay, we're gonna do the okay, can't remember what it's called. We're gonna do that one. Bicep, tricep, okay, there we go. Bicep, tricep, plantar, or not plantar, patellar, Achilles, okay, and then you might have to turn your feet this way, I'm sorry, and then we'll do the Babinski. That's fine. Okay, all right, thank you so much. That finishes my head to toe assessment.